Hi, y'all. I'm Andrea Carrillo. I am the Director of Development and Advocacy with Unidos Nueva Alianza Foundation. My second hat, for lack of a better word, I am the Grant County Lead for the North Central Early Learning Coalition. I'll let you present yourself.
And my name is Mariah Montero. I'm a birth doula here in Grant County, and we both facilitate the sacred support group for the perinatal peers that we have in our community. Real quick, for my own, well, first of all, this is a mental health summit, so I think we all deserve a little bit of grounding for ourselves, and it's also selfish because I'm a little nervous. So I'm going to start with a little bit of a breathing exercise just to kind of center our days and just to renew ourselves. So if you guys all want to just go ahead and close your eyes, make sure that both your feet are planted on your ground beneath you. And also want you to imagine that you have a root system coming from the ground up into your feet. And remember that the oxygen around you is replenishing and it's fresh, it's sweet. And so when you breathe in, imagine all that good stuff from the ground coming up into your body systems. Go ahead and take a deep breath. And on this exhale, imagine all those stresses and all that CO2 and all the stuff that's no longer serving you. Go ahead and release that out with your next breath. Just like one more nutrient breath, all that good oxygen, replenish yourself with a fresh new time. And go ahead and let it all out. Everything that you don't need anymore, everything that's packing you, just loosen up that next breath. Let's do one more of those. Bring in the good, feel fresh. Let out that stress and the old no longer serving you. And whenever you're ready, feel free to come back with us. This nice little presentation. Thank you.
Thank you, Mariah. So today we're going to talk about emotional well-being during pregnancy and early parenting. Obviously, we're not mental health professionals, so this is meant to be a supportive, awareness-building conversation. And we're going to touch a little bit on why this topic matters. So obviously, I guess let's start with this. Show of hands, who is a parent? Okay. Nieces, nephews. So your average person has some type of child, right, in their lives. And the transition to parenthood, it can be joyful, and it is, and also like super overwhelming. Both truths can exist at the same time. Pregnancy and early parenting can bring major life changes, emotional ups and downs. They're common, normal, right? When you're going through it, that might not feel that way, especially if it's your first kiddo. Support can make a big difference, and many parents feel pressure to have it all together.
Real quick, I did want to, I'll pull up the numbers because I don't have them 100% memorized. But the Department of Health dropped our maternal mortality review panel last year, and the numbers are pretty alarming. And so about 82% of pregnancy-related deaths were preventable here in Washington State. Let me see here, I believe it was 45% of behavioral health-related deaths, including death by suicide, homicide, or accidental overdose, accounted for nearly 45% of those deaths. And so the recommendations that they have to make these numbers not look as bad as they are, or to improve these numbers, is to improve healthcare quality and access, strengthen community support services, and provide equitable, cultural responsive care.
So what is perinatal mental health? It is literally the mental health that refers, obviously, like we said, emotional well-being during pregnancy, after birth, really up to that first year, and sometimes longer. It can include things like stress, anxiety, mood changes, feeling overwhelmed. We are literally talking about overall emotional wellness, like not just diagnosis.
Becoming a parent can involve physical recovery, sleep, changes, identity shifts, relationship changes, financial or work stress, and cultural or family expectations. When a pregnancy is planned and wanted, the adjustment can still be hard. I think we have normalized a lot of like, when you just have surgery, okay, you had the surgery, now it's time to recover and go, you are recovering from this major surgery, but we don't see that a lot within, a lot of support happening within the perinatal period. It's kind of like, all right, you had your baby, you still look good, let's get back into normal life. And we can't normalize that. We need to let people heal from what they just went through, and the whole, the identity shifts as well.
So I feel like this is, at least when I was looking at like pictures, this is what comes to mind for your average person that has never had a child, right? It's a lot of, oh, this is so wonderful, this is so great, and really, right, that inexperience in parenthood, and it's what we push, I feel like, as a society, right? Like, this is the norm, or like the dream of becoming a parent. But the real transition to parenthood looks a lot different. And so it rarely looks like the pictures that we just seen. Like, yes, there's many of those small moments, throughout the day, but really, we don't show the normal pics, the crying babies and moms, sometimes dads, body changes and tired parents.
Many parents may experience feeling exhausted or touched out, worrying about doing things right, feeling isolated, mood swings, grief about loss of independence, pressure to be a perfect parent. These experiences are more common than people talk about. Some parents may need extra support if they're experiencing lack of family or community support. I cannot articulate my words today, so thank you for bearing with me here. Financial strain, complicated pregnancy or birth, previous mental health challenges, trauma or stressful life events, immigration or language barriers, rural isolation, and this is especially important in the communities many of us serve.
So things that support emotional well-being, being seen and heard, practical help, right? Meals, childcare, transportation, all the stuff that you need on a daily basis that you're adding extra stuff to when you gotta carry. I just lost my train of thought. I was thinking stroller, but it's not a stroller. The car seat everywhere with you. Peer support, cultural connection, rest and recovery, access to trusted information, partner or family involvement. And support doesn't always have to be clinical. I think that's a big one during this time period. Like, it doesn't have to be clinical to be powerful. A lot of folks, like I said, it's like our society norm that we don't talk about this stuff. And sometimes, especially if you're a new parent, you're like, okay, I'm feeling this type of way. Like, is it just me? Because I don't like hear anybody else talking about it. And so it's important to like start normalizing those conversations that obviously seem uncomfortable at first, but it is real and it's valid. So this is some data from the Perinatal Support Washington, and it says here that 15 to 50% of moms have some type of perinatal mood and anxiety disorder, and then 10 to 20% of dads. And that range is because it's encompassing like multiple sets of data. So really, depending on the data you're looking at, it can range anywhere from like the 15 to 50%, and then the 10 to 20%. And that obviously just depends on how many people they actually took the data from. And then, so with that, right, like not just the mood and anxiety disorders, those are the most common, but also like if you look at these are some other complications that arise, right? So preterm delivery, gestational diabetes, preeclampsia, hypertension, postpartum hemorrhage. So the mood stuff, anxiety, like is higher than all of this.
Perinatal mental health anxiety disorders that can occur anytime during the prenatal period. So it's not just her, it's not just depression, it's not just postpartum. So like baby blues and depression, sometimes those two can kind of get mixed up, or people don't really know the difference between like, is this normal to have all these thoughts that I'm having, or where's it, baby blues and then drops off into postpartum depression. And all these can pretty much arise at any point. Oh, we're gonna get into that. So 60% of perinatal depression begins before conception or before birth. And so we have these numbers here. Some people that already have underlying mood disorders, or people who become pregnant and then find that they have perinatal mood disorders, or then a bigger population can develop perinatal mood disorders after they give birth. And so how can we support parents? We can listen without judgment, normalizing mixed emotions, encourage self-care, connecting families to resources, creating safe community spaces, respecting cultural parenting values. Our role is not to fix, but to walk alongside people within our communities.
Also, it may be helpful to suggest additional support if a parent feels persistently hopeless, cannot sleep even when baby sleeps. That was my big one, because I felt like I had to do all the other things while the baby was sleeping, right? Like, I remember people would tell me that, and I'm like, okay, but then how am I supposed to get everything else done if I sleep while the baby sleeps? So for me, I'm like, I hate when people tell me that. Feels disconnected from baby, has intense anxiety or panic, talks about harming themselves. Again, we are not diagnosing, just recognizing when more support is needed, and obviously above your threshold of services or support that you can actually provide.
And so knowing where to refer is one of the best things we can do. And the Grant County Health District has started for the birth to 5-year range. We have some brochures available of resources and flyers for a local mom care support group that is open to all birthing people. If you know of a resource that's not listed on the brochure, please reach out to one of us. Dre and I are the ones that are facilitating this. We do have a location change, so it's no longer at Women's Embrace, but we'll get that soon. So don't show up to Women's Embrace, because we won't be there. I think the biggest thing too is, at least I can speak for myself, that I think, again, for my personal philosophy, that connection kind of overcomes the whole professionalism. So for me, I want to have a connection with my patients. I want to get to know you. I want them to feel safe in my presence. I don't really want to come in and be like, I want you to understand that I'm one of you. And I think that's so important to also have somebody there that you know is on your team, that you know is not going to judge you, and you know that isn't going to judge you for not brushing your hair today. Because it's just, I just can't, I don't know how further to elaborate on that, is how important connection is over professionalism for, a lot of peer support groups. And that's where peer support really does show itself. Like, hey, I'm not, we're equals. There's no hierarchy here. We're all here because, we're community. This is your tribe. So it's very important. It's a very beautiful space for sure.
And also, I think just to add on to that, I think the biggest thing, at least for me, that I was like, wow, is that I had mentioned before, right? That like a lot of people don't have that community, and I, for myself, I tend to forget that because I'm blessed to have a good support system, and like not everybody has that, and so people are literally just by themselves, thinking that whatever their thoughts are, however they're feeling, it's just them, that's just their normal. When in reality, like we all go through it. It's just we don't talk about it. So I feel like that's been a lot of the conversations that we've kind of talked about. Is like, oh, like all my friends had kids. Like it sounded like it was so great, and they never talked to me about this stuff. And so then I'm experiencing it, and I'm like, is it just me? Right? That was like the big thing. I think that like really pops up that we talked about. and I feel like too, it's a safe place to like trauma dump. We be hearing about all kinds of stuff, and I'm like, yes, that's what it's for. If that's what you want to use it for, like we're here for it.
Yeah. Or how often people are just oral processors. They have to keep these things in internally. They go about their day being moms, and it's so hard to, have another adult. I don't know. Sometimes I talk to my 3-year-old, but she doesn't understand as well as Dre would. So it is nice to just get it off your chest, and and then somebody else in the group is like, hey, that's me too. Like I also struggle with this, and then it's so like we're holding each other instead of like, feeling guilty or feeling like I don't have a community. But it's like, wow, it's this huge group of people that I can relate to, and I am not alone. So it's just such a beautiful thing.
And then touching a little bit on cultural humility. So obviously parenting experiences vary and are very individual, right? So like vary by culture, family roles and expectations differ. Language access obviously matters, and so immigration stress can impact well-being, and respecting that lived experience. In many communities, emotional struggles, like talked about, like they're not openly discussed. And so this is like sometimes the first time that they're like having that experience. Like we've had some folks that get like super emotional. So they're like, oh, like we just really thought that this was like normal, and that we're just like being bad parents because we're feeling so overwhelmed. So again, like it's just not normalized to talk about the struggles of parenthood.
And healthy families need compassion, community, education, and access to support. Supporting perinatal mental health is not just clinical work, it's community work.
And then because Mariah is a doula, we figured if we can open it up, if anybody has any questions about the presentation or like anything more in depth. Mariah is a plentiful source of knowledge.
I can talk all day.
Yes.
Do we have any questions? Go ahead.
Do you or have you assisted with like at-home water births?
It's not very, we don't have a home birth midwife here in Moses, but I have gone to like Yakima and Wenatchee and helped them out at their birth center. I personally haven't actually gone to a home birth, but I have gone to like out of hospital facilities. Go ahead.
Do you feel that there's a negativity on supporting this area, like the women's health, and just not enough focus on it here in Moses Lake?
Oh, that's a whole, I could write a book.
Okay. Here's some key points, because I'm going to speak with council and I'd like to bring it to them.
I think for starters, just being able to have, like, obviously, like, places like this is great to be able to network and connect with people. I personally, work with the Medicaid population, so there's a lot of things that kind of arise that I didn't really foreseeing, like connecting people with housing, connecting people with, like, oh, I'm 8 months pregnant, but I need a job and I don't know what to do, and being able to connect people with those resources too. That's also kind of like my bad because I didn't realize I've met like 3 awesome people that I could have referred to later on before I came here. I think also just bridging the gaps between different relationships that we have between myself, between the families that I serve in the hospitals, and like how I think there is a big misconception that we're all kind of against each other, but instead we all have the same goal at the end of the day, that we want to see healthy, happy families. And so, like, I'm not here to tell anybody how to do their job. If I see something, that's not okay, then of course I'm going to go to nurse management or make a referral or a report to them. But for the most part, I just think that, and I don't think it's like anything like against the city, but I think as a community it would be nice if we had better warm handoffs to say, hey, I know this person, and I think they're really great, and let me refer you out to them. Because if it's not, it's like, oh, here's his phone number, and we'll, then I get people next week that I'm like, how are you doing this week? And they're like, oh, the same. And it's kind of like, oh, okay.
So just one last question. So with a lot of the homeless people that are pregnant, would you
think preparing everybody. I think I don't think birth should be inherently traumatic, but being able to prepare. I kind of have this thing where I compare how people prepare for births and how people prepare for weddings. And it's kind of like, oh, we're just gonna hope everything goes well and don't really talk about it until it happens. And then you have people who buy $2,000 wedding dresses and go cake tasting and stuff. But everybody should have the luxury, or not luxury. I don't think birth support is a luxury. But yeah, being able to have that education piece and being able to, first of all, know what to expect. Because not only are we talking about planning for the birth, but we're also talking about how are you going to get your food? Who's going to feed you in your postpartum? Where are you going to stay? The question I ask everybody. Who's going to, where are you planning on living in postpartum? How can we also plan for the perinatal, the birth transition, but how can we also talk about how things are going to go after you have your baby as well? Go ahead.
Can you talk a little bit about how the coverage for doulas has changed in the last couple of years in terms of payments?
Yeah. So historically, before January 1st of 2025, doulas were expensive. I saw $800 to $3,000 for a doula. And starting January 1st of 2025, thanks to the Doulas for All Coalition, doulas are actually covered under Medicaid by 100% cost. So what it looks like is a 2-hour prenatal support is the first one where we go and kind of just okay, what are your goals for birth? And again, talking about the cultural things, talking about big question is, do you have any perinatal mood disorders or pre-existing mood disorders that might exist in the perinatal period as well? Going through all that, how do you want this to look? And if that doesn't go well, how can we talk about the different, what's plan B? If you plan a home birth and you want this beautiful thing, that's great, and I'm going to support you in any way of that. But what if you're in labor for 36 hours and the epidural sounds pretty good right now? How are we going to slowly transition to that so it's not oh no, guys, we didn't plan for this. This is crazy, not chaotic, or instead it's okay, you know your options. We talked about this. Now we can smoothly transition into the next plan. And then after that, there's 18.5 hours that can be utilized in the prenatal. So people, especially that are VBACs or what's a VBAC? Vaginal birth after a cesarean, or first-time moms, or anybody who needs that extra support, they have 18.5 hours that I can also come and utilize them. As a client-led, I'm just kind of whatever you want to talk about, I'm here for. Even if it's just oh, I spilled my cup of milk and I'm crying and I need someone to talk to and support. That I'm that person for that. Also, continuous care of the labor and delivery is fully covered too. So the moment that you feel like you need support, you need that person there. Up until you give birth, I even stay after they do the newborn care, just make sure that everybody's settled in the hospital. And then after that, so there is 1.5 hours reserved for the postpartum period that you always have those 1.5 hours plus the whatever you don't utilize of the 18.5 hours you can use towards postpartum. So it's 20 hours total of additional care for prenatal and postpartum that can be utilized at pretty much any time from the moment they are covered or they test positive up until 1 year after they give birth.
And have you seen an increase in the number of doulas because of that?
Yes, and that's also my intention because we need more doulas for sure. If I get sick or my car breaks down or I, God forbid, break a leg or something and I promise this person care and support, I need someone to step in for me, somebody that I care for, somebody that, I never want to send in somebody that I don't have the same philosophy with. We build relationships with them and I want to send in somebody that, has the same techniques and skill set that I can say, hey, I may not make it to your birth, but here's Dre, who's also spitting baby strength, who also speaks Spanish, and who also would support your birth plan. I know that versus somebody that I'm oh, they don't really like to support VBACs, but here you go. So that's where it is really important. So.
What if you have a patient who you started helping, but you lost the baby, or turns out it's a tumor? Can you still help for a certain amount of time?
So in the billing guide that it says that no matter the ending of the pregnancy, whether it's miscarriage, abortion, or birth, that it still covers up to that labor and delivery part. So matter the outcome of the birth. I can't remember how it exactly says in the billing guide, but it's still covered by the doula benefit.
But if it turns out that they thought that they were pregnant, but it's just a, what is that? Tumor. No, it presents itself as a pregnancy. You still get those hormones. Oh, I had it, and I don't even know what I had it.
Are you talking like an ectopic pregnancy?
No,
It's like an actual tumor.
I don't
Yeah.
know about that one actually. I haven't really. I just we have full access to the HCA page. So usually what I do is I just look up if they're eligible for the benefit, and I just bill that way. So if the Apple Health says that they're pregnant, then I just kind of go off there. Never.
I literally had jeans and skin hair.
That's hard.
Molar pregnancy, sorry.
Oh, okay. Yeah, I would believe it's.
Because it still has that word pregnancy in it, so it
Yeah.
still counts.
Yeah. Donnie can yell at me if it's not.
You would think that if the patient was diagnosed, that would be enough for it to be covered, you would think?
I think so. That's a good question. I'll have to ask. I'll look into that. It's a good question. I don't know right now, but I'll find out. Go ahead.
What's the process like to become a doula?
So it's different for lots of different, there's different organizations. So if you go onto the Department of Health website, they have doula approved trainings that the coalition has looked into, and that they said, okay, these trainings do meet our guidelines. And they also have to go through a whole enrollment process. So you just find one of those trainings that suit for you, go through it, and then you could meet with Doulas for All Coalition. They do the enrollment support, so we help get your state certification, get your NPI number, and enroll in the healthcare authority. And I also do that too. So if there's doulas in the area that are like, hey, Mariah, I need extra support. This thing looks crazy. And it does look crazy. It is hard. I have the training to be able to support somebody through the 3 application processes.
I was gonna pull up the healthcare authority, like how to see if there's any doulas that actually take Medicaid in your county, but for some reason it's not actually showing me the full link. It's only giving me like the copy. You know what
I know of the Doulas for All website. They have a directory on there.
The link on our
Doulas
website?
for All.org. So this is the Doulas for All Coalition that they put this directory together, and they work really closely with the MCOs. So right now it's kind of a backwards process that if somebody goes to their provider and they're like, hey, I want a doula, that they would kind of contact their MCOs and contact us, is my understanding. But this way you can kind of just go through all the doulas that have enrolled in this directory. So this directory might look different than the provider search on the HCA, what am I trying to say, the website. But this is also a great one too, because they've gone through and, you know, what culture do you want to serve? What areas do you serve? And all that good stuff.
Like for the county?
Yeah, you can click grant. You should be able to look up the area.
Oh, yeah, right here. You're the one that came up. On the HCA, I'll have to, I can include the link whenever we send out the information for this session. But in essence, it's like super easy to use. You literally just filter it by your county, and then it'll show you the doulas that have actually registered with the healthcare authority and will take Medicaid. Because there isn't very many. There's a lot of doulas. There isn't very many that will actually take Medicaid clients. So the last time I looked for Grant County specifically, it was just Mariah and Liz.
And Reagan.
Oh, okay. Reagan. Oh, she's on there.
Yeah, she's
Cool.
pretty new.
Okay. Yeah, so obviously if you go into smaller counties like Okanagan, there's even less. so that's really the goal, is to get, right, more doulas, and more than anything like that, that representation, right, that diversity that we have in our communities, making sure that it's like anything else. I know Mariah likes to tell her folks, like, literally shop for your provider. Like, you're not, just because you went to them and you're 6, 7 months pregnant, it doesn't mean you have to stay with that provider. If something happens and you don't feel comfortable, find somebody else. You can do that. And I think too, you kind of touched on this the other day, and I was like, oh, that's so real. Like, our bodies literally are designed to do this as breathing people, and so when you feel safe and comfortable with the people that are around you, it's going to be a better experience. And when it's the opposite, that's when sometimes those complications arise because you're tense and obviously feel unsafe. So making sure, same thing, right, that you know, if there's more than one option and you have Medicaid for doulas in your area, like, talk to all of them and see who you vibe with the most, and go with that option, because literally, I know Mariah likes to say this all the time, but I'm like, this is so true too. Like, giving birth is a ceremony. Like, we've very much, as a society, made it like it's not that big of a deal, but it is. Thankfully, I feel like Washington State is moving towards the right direction as far as, like, you know, paid family leave, and you know, moving that needle on, like, the child care access, but, like, we have a long way to go. And really just, you know, providing those supports for families, because when our families are doing well, like, that's going to trickle down to the kids as well. I can't remember off the top of my head what the stats are, but, like, specifically for, like, the early learning realm, I think it's like for every dollar invested, it's like 17 to 24 bucks is what we save in the long run. And so I think really honing in on those experiences and making sure that our families have, like, what they need to, you know, the most that we can do. So obviously, like, we have a long way to go as a state, but in my mind, I'm like, when I look at the budget that came out, and I'm going on a soapbox, but the budget that came out before session ended from our governor, and, like, obviously there was cuts across the board, but, like, the one that took the biggest cut was in early learning. And so to me, like, that speaks volumes, because you can't say that you want families to thrive when you're literally cutting from those resources. So that little soapbox to say, if you're not connected with your legislators, your representatives, like, get involved, and make sure that you have those conversations. And if you don't like your representatives, then also, like, still get involved and find people that are willing to run, or you prepare yourself to run, because truly stuff's not going to change until we get people in positions of power that are actually for community, and not just saying they are, but then when it comes to voting time, they're voting against what we need, right, as families to thrive. So just want to throw that in there too.
Yeah, that's great. I do want to even touch a little bit on the peer support part of, like, the professionalism and connection of, you know, at least for, like, the doula piece, that, you know, I'm obviously going to ask questions of, like, are you planning with the epidural? Do you want to do, you know, where are you planning on birthing? But I think it is important to also ask people questions like, what are the first words you want to say to your baby when they're born? Have you had any dreams about your baby? It's just, like, really making those personal connections too, to really make people not feel seen, but we are seeing them, right? It's genuine, not trying to, like, make them feel a certain way. Like, I want them to know that we actually care about you and your community is here for you. And so just really bridging that gap between, like, the medical, you know, the mundane, and also, you know, the humanity within what happens in this time. So, do you have anything to add?
I think I said my little soapbox.
Thank you, guys. To talk about it? Oh, she's not. I was thinking about it, like, a little bit ago, but I'll just leave it. No, I'll be